Metformin. Metformin is one of the most common medications prescribed for type 2 diabetes, but how does it work and what should you know before taking it? Let's dive into all the essential details. Metformin is an oral medication used to manage type 2 diabetes by controlling blood sugar levels. It is often the first-line treatment for diabetes and helps improve the body's response to insulin. Mechanism of action: decreases hepatic glucose production. Metformin works primarily by reducing the amount of glucose produced by the liver, which helps lower blood sugar levels. Improves insulin sensitivity. It also increases the sensitivity of muscle cells to insulin, allowing more glucose to be absorbed from the bloodstream into cells for energy. Reduces intestinal absorption of glucose. Metformin may slightly reduce the absorption of glucose from the intestines, further aiding in blood sugar control. Result: lower blood sugar levels without causing excessive insulin release, which helps prevent dangerous spikes or crashes in blood sugar. Indications or uses: type 2 diabetes, mainly used to help control blood sugar levels in people with type 2 diabetes, especially when diet and exercise alone are not enough. Polycystic ovary syndrome, PCOS, sometimes used off-label to help manage insulin resistance and symptoms of PCOS. Prediabetes, can be prescribed to help prevent the onset of type 2 diabetes in people with prediabetes. Side effects: common side effects, gastrointestinal issues, nausea, vomiting, diarrhea, or bloating. Metallic taste in the mouth. Less common side effects: fatigue or dizziness, skin rash or muscle pain. Serious side effects rare. Lactic acidosis, a rare but serious condition where lactic acid builds up in the blood, which can be life-threatening, more likely in people with kidney issues. Vitamin B12 deficiency. Prolonged use of metformin may lead to decreased levels of vitamin B12. Drug and food interactions. Drug interactions: insulin or sulfonylureas, e.g., glipizide, increased risk of hypoglycemia, low blood sugar. When combined with metformin, diuretics or corticosteroids can increase blood sugar levels and reduce metformin's effectiveness. Alcohol. Drinking alcohol excessively can increase the risk of lactic acidosis. Contrast dye for imaging tests. Avoid metformin for 48 hours before and after a contrast dye procedure, as it can increase the risk of kidney damage. Food interactions. It is generally advised to take metformin with food to reduce gastrointestinal side effects. Be mindful of your carbohydrate intake, as this can affect your blood sugar levels. Contraindications. Absolute contraindications: kidney disease, severe renal impairment. Metformin is cleared by the kidneys, and poor kidney function increases the risk of lactic acidosis. Lactic acidosis, a rare but serious complication associated with metformin use. Severe liver disease. Metformin should not be used if the liver is not functioning properly. Relative contraindications: heart failure or severe respiratory disease. Metformin should be used cautiously in patients with heart or lung conditions due to the risk of lactic acidosis. Alcohol abuse. Chronic alcohol consumption increases the risk of serious side effects. Patient advice: before taking metformin, inform your doctor if you have kidney or liver disease, are pregnant, or have a history of lactic acidosis. Discuss all other medications you're taking, especially those affecting blood sugar, while taking metformin. Take with meals to help minimize stomach upset. Monitor your blood sugar levels regularly as directed by your healthcare provider. Stay hydrated and avoid excessive alcohol intake. Follow a healthy diet and exercise routine to enhance the effectiveness of metformin. Lifestyle tips: exercise regularly and maintain a healthy weight to help manage blood sugar levels. Keep a consistent eating schedule with a balanced diet to avoid blood sugar spikes or dips. Finally, metformin is a cornerstone treatment for managing type 2 diabetes, but it's important to understand how to use it properly. Have you taken metformin or have questions about how it works? Let us know in the comments below. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon for more tips on diabetes management and medications. Let's take control of our health together.